6:31 now. The next time you or someone you love needs surgery, don't be surprised if there's a robot in the operating room. Nearly 5,000 hospitals are now using robotic surgery systems, that is. And Fox Medical Team's Beth Galvin joins us now with the pros and cons that patients really need to know about. Morning, Beth.
And good morning, Elise. And I think it's a given that probably many of us think that if we have the option of going with a robotic surgery, that's going to be a better option for us. But that's not necessarily true, especially when it comes to more routine surgeries. So we talked to two surgeons and asked them to weigh in on what you need to know about robotic assisted surgeries and what kind of questions you should be asking. So the first thing you need to know about robotic surgery is there's no actual robot calling the shots.
It is an instrument that the physician uses. So what's important here is not just the sophistication of the race car, it's the driver.
And Dr. Todd Oberle, medical director of Georgia Urology, has been the driver on more than 500 robotic-assisted laparoscopic surgeries for patients with prostate, bladder, kidney, and adrenal cancers. Instead of standing over the patient in the OR, he sits at a console, remotely controlling a series of tool-mounted robotic arms that mimic his hand movements.
Instead of being a two-armed surgeon, I'm a three-armed surgeon. That coupled with 15 times magnification, 3D view, I'm able to see a lot better.
Oberle says that's important when it comes to more complex medical cases. But Dr. Barry Zisholtz, another Georgia urology surgeon, takes a more traditional approach, hands-on open surgery, sometimes using scopes.
So open surgery, you can feel the surrounding organs. You have tactile feeling.
Dr. Zisholtz says you can't get that sitting at a console. But Dr. Oberle says there are some advantages to robotic-assisted laparoscopy, especially with more complicated cases.
Decreased blood loss is not in question. Decreased hospital stay is not in question. Decreased pain after surgery is not in question.
When it comes to prostate surgery, most of the studies show that after 30 to 60 days, the results are about equal.
And if you're considering a robotic procedure, both doctors agree that the surgeon's experience level matters. So ask a lot of questions.
How many of these cases have you done? How comfortable are you with robotic surgery? What are your outcomes with that?
And those questions are important because there is a learning curve when it comes to using those robotic systems in the OR. And Dr. Oberle performs about 5 or 6 of these procedures, he says, a week. So you really want to find a surgeon who's comfortable with the technology that they're using and does these surgeries quite often, you know, kind of on a regular basis. So really important questions to ask your surgeon before you sign up for that.
You wouldn't know that. Yeah, very important. Okay, so what does the research show when you compare robotic assisted surgery to these minimally invasive procedures?
So that's what's really interesting because the findings are really mixed. I mean, when you look at some of the studies, for example, there's one study on bladder cancer, it found that there were short-term benefits to using the robotic or the laparoscopic systems, but there were no real long-term benefits over open surgery. But there was another study that involved bladder cancer, and they found, cervical cancer with women, and they found that the laparoscopic or the robotic assisted surgeries had more complications, more recurrences of the cancer down the road, more deaths in the women that got the robotic or the laparoscopic procedures. So it's not going to be a great fit for everything, and that's why it's really important to ask these questions and to continue these studies to find out, are there certain things that it's great at? Are there certain things that we shouldn't use, robotic systems for?
And that really does sound like that's what the key. You shouldn't just assume that robotic surgery is the way to go.
Yeah, I think that you really need to talk to your doctor about your individual case. What are your options? If your doctor is talking about using a robotic system, are there any other options? What are your outcomes? That kind of thing. Asking a lot of questions.
It's your life, right?
It is your life.
Got to ask those questions.
Yes.
Beth, thank you so much.
Thanks,
we appreciate it.